This is one of 3 openings I'm going to give for my History of Psychology course, an online narrative. And they'll all be published as YouTube videos and then offered through a GoDaddy website by the same name that you can pay a subscription to, kind of like Ancestry.com, except it's not your family's history, it's the history of the science and the practice of psychology. So I begin in part by tracing back the roots of psychology into one of its occult practices, as the historian and writer Morton Hunt has called it. He has a book out called The Story of Psychology, which is the same title as Bob Bowles' book, and I use Bowles' book at the University of Washington to teach those courses when I was still lecturing there. But I got in the habit of opening my course with a history of hypnotism, and that is Derek Forrest's scholarship, and Forrest was a European scholar at one of their great universities. I don't recall if it was Oxford or Reading. My sense is it might have been Reading. But he wrote a wonderful history of mesmerism and hypnotism that I came to use. And here you have on the cover a depiction of what became known by the 19th century as action at a distance. So a mesmerist exerting his influence, practicing mesmerism with a subject, hypnotizing her, if you will. Originally, we called it magnetizing because of its relation to the planets and their magnetic pull. So why open and why trace the origins and history of psychology to its occult practices? Well, for good reason. Some of those late 18th century practices made it up into the 19th century and even into the late 19th century. Mesmerism in Franz Anton Mesmer's hands, for instance, became neuro-hypnotism by the 1860s, as practiced by Braid, the American, and then simply hypnotism in the hands of the Americans and the French Nancy school that became the most prestigious school for the practice, but also for the understanding of why hypnotism seemed to work. What's more, it was taken up recurrently through the 19th century by a series of medicine men. And one of those was England's Elliotson, who was the discoverer of pollen. He actually discovered pollen as a protein during the early part of the 19th century. And he pursued mesmerism in his practice at University Hospital. And he wrecked his career on it. Many of the medicine men were so fascinated and so mesmerized, if you will, by the practice and by the potential of the practice for healing that they wrecked their careers. They risked a lot in backing mesmerism, and many of them failed and ran aground for doing so. Jean-Marie Charcot, the great Charcot, the Napoleon of the neuroses, as he came to be called, also was one of these 19th century medicine men who believed in the potency of hypnosis, in his case, in treating hysteria. And Charcot was a wonderful diagnostician, maybe the greatest diagnostician in the history of medicine. Charcot told apart multiple sclerosis from Parkinson's disease. He figured out a way to distinguish those two disease states. He also was known for his Charcot's disease, which was one of the initial attempts to characterize ALS, or what became to be known as Lou Gehrig's disease, by the 30s and 40s. Charcot had been the originator of the first one who noticed and characterized that disease state. And he also used hypnosis as a diagnostic tool, much in the way an acupuncturist might use their craft for diagnosing an underlying injury or cause of symptoms or a problem, a health problem, health defect. Charcot used hypnotism to tell apart the various stages of hysteria in men and in women, mostly women, at the Salpêtrière, where he practiced, and that became this great institution of medicine. And it was Charcot who also originated the very impersonal, very sterile practice of treating patients in the waiting rooms. He would literally strip his patients bare and have them paraded in front of him while he made his diagnoses and noticed differences in their symptomologies. So he gave us our modern medical practice of having to wait and feeling like we're mistreated in the waiting rooms and in the consulting rooms of our doctor's offices. That originated with Charcot. In any case, there's a second reason that I open with the practice of mesmerism, and that is that some of the psychotherapeutic dynamics and healing practices that formed around the practice of mesmerism and around the practice of hypnotism persists to this day. So, for example, Mesmer's disciple Puysegur noticed that mesmerism might be used to take his patient into a benign crisis, to sort of go through a benign crisis with their patient, to recruit the patient's insights, to recruit their resources, to recruit their gifts in healing, and use the patient as an ally in their healing. And that practice of involving the patient's insights about their disorder, their mental health disorder in particular, persists to this day in the clinical realm. And we have what are known as insight psychotherapists who supposedly are experts at working with their clients and working with their clients' insights to treat them. As well, the powerful dynamic of transference, the psychodynamic principle of transference, which is one of Sigmund Freud's enduring legacies. This is a young Freud, probably about 1895, who came to work with Charcot and to learn about hypnotic practice with Charcot as his student, as his fellow in Paris, and was very taken by Charcot. But Freud is more known and more renowned for having discovered the transference principle, by which a patient transfers their important feelings onto the therapist, and that furthers the process of psychotherapy and psychoanalysis as practiced by Freud. But transference as a dynamic was noticed more than a half century in fact, before Sigmund Freud ever hung his shingle in Vienna. It was noticed by a naturalist named Deleuze, who naturalists in those days were the best scientists, and Deleuze is noted in Derek Forrest's history. Deleuze, by about 1825, had recorded one of the earliest instances of transference when he was magnetized at a dinner party by a female, and he noticed the persistence of feelings that he had towards this female for several weeks beyond the time of being mesmerized by her. So you could say he was literally mesmerized by her, or you could say certain feelings attached to the treatment he received, and he noted this, being such an adept scientist, he noted it and recorded it for probably the first time in the record. So the history of hypnotism and mesmerism is, in a very real sense, the history of psychotherapy in the world. And some of the approaches taken by the mesmerists were insightful and guide practice in American psychology and psychotherapy to this day. So there's an opening rooted in an occult practice of mesmerism or hypnotism. And of course, hypnotism is also practiced to this day. And I have a guest lecturer, Lisa Geiger from Edmonds, who has a practice set up in that seaside town and who will often come to class and has come to class in the past to lecture on her use, her present day use or current day use of hypnotism and healing. So there is one angle for coming at our history of psychology, and one that is more clinically oriented than some of the other approaches I'll take to opening the course.